I think the common signs of having a gum problem are you're brushing your teeth, and when you're expectorating the toothpaste into the sink, you notice some blood in the sink. So bleeding gums or bleeding when you brush, those are the most common symptoms. But some people don't have that much bleeding of their gums, but their teeth are starting to get loose. So it could be too just some mobility. You can kind of grind your teeth around or take your fingers and move your teeth, and you can start to feel a little bit of movement of your teeth. That's an indication that this gum disease, this bacterial infection, is underneath your gums. And when you smile and you look at your gums in the mirror, they'll be red and puffy. So red puffy gums, whether they bleed or not, is an infection in the gums. Loose teeth, that's typically due to an infection in the gums as well. Noticing that your teeth are starting to get longer. You're packing food in between all your teeth after every meal. There's a reason for that. It's either gum recession from clenching and grinding, or it could be due to infection too. If you look in the mirror and you see your gums are red and puffy, you have an infection. And so the advantage of doing a laser treatment versus doing a traditional treatment is when you have these red puffy gums and you have a traditional surgery, you're going to have gum recession at the end of it. And you don't have that with the laser procedure. So the beauty of your smile, the cosmetics of your smile are maintained. Well, I think we all kind of put our head in the sand sometimes and hope that things will just get better on their own. But gum disease, the way that this infection works is it gets under your gum. It takes about 3 weeks for bacteria to get underneath your gum. And it takes about 3 months for that bacteria to grow enough to actually begin an infection that starts to damage you. And as it grows, as this infection gets bigger, the bacteria in this infection change from bacteria that breathe air, which is what started at the neck of your teeth, at the gum line. But once they get underneath the gum, different types of bacteria take over, and they breathe CO2. They don't require air. And so they don't have to come up for air, so to speak. Your own body provides them all the CO2 they need. So they will continue to grow and eat the bone away from your teeth. So you'll lose teeth as a result of this. But even worse, if you're a patient who has had heart problems, for example, we know that gum disease raises your risk of heart attack and stroke. And the reason it does this is because it creates inflammation in the body. It raises your total body inflammation. And so when you go to your physician and you're having blood tests and you've got high blood pressure, they've got you on these medications, one of the risk factors they may note is that you have a higher body inflammation as noted from these blood tests. Gum disease can raise that total body inflammation and raise your risk for heart attack and stroke. But the studies have also shown that if you've had your gum disease treated, within weeks, those total body inflammatory markers start going down. So it's important to treat your gum disease, not just to save your teeth or prevent your teeth from getting long, but it's important for your health as well. Studies have shown it increases rheumatoid arthritis or arthritic symptoms. By having this infection, it creates more inflammation in your joints. It's been shown to increase blood glucose. So patients that have diabetes, their blood glucose can be up to 20 points higher because they have an active infection in their mouth. And when it's treated, it tends to go down those 20 points too. And so there's body-wide implications. A recent study that was just published within the last couple of months, men who have prostate problems, gum disease actually causes the prostate to swell and get bigger. And so there's lots of reasons to get this treated, because this infection doesn't just limit itself to your mouth, it affects the rest of your body. A lot of general dentists will provide initial therapy. I've had lots of patients who have told me, well, I had a deep cleaning done, and a deep cleaning is a good initial therapy. It helps reduce the infection in your mouth. It doesn't typically clear it, but you'll after a deep cleaning at a general dentist office, you'll typically see that the swelling and puffiness of the gums goes down. But the pockets tend to reoccur within months after having a treatment like that. So it's an initial treatment, but it doesn't truly resolve the problem. So seeing someone like me, especially someone who can do a laser type of approach, we can get you on a long-term program of making your teeth and your gums healthy and keeping them.